Dr. Arup will be speaking on two topics simultaneously. I mean, back to back. One is nucleus cheese wiring getting converted into bowl. I mean, mostly happens with that softish ones. And again on intraoperative zone law dialysis. Sir, please.
Good morning, everyone. This is a wonderful session initiated by Dr. Srini a couple of years back. The what next in cataract situation in cataract surgery. So this time, every time we are came out with a different problem, and this time I'll talk about the nucleus cheese wire and nucleus get converted into the bowl. So why it happens? It is basically a mismatch parameter, the hardness of cataract and your parameter setting. So it's sometimes a very difficult how hard your cataract is, the hardness of the nucleus. So, and even today's scenario, we are using the retroillumination coaxial. Even it is sometimes very difficult how hard it is, and we can set higher parameter and get it to convert it into the cheese wire or ball formation. And the faulty technique, there may be some faulty technique which can leads to this conversation. And the this is mostly happen is during the chopping session. The people who do the stop and chop regularly, they do not encounter this type of problem very rarely, but there's who are doing the very chopping technique, this encounter this problem. The different machine and different Phaco tip is the most important. You should know how your machine behave and the type of tip you are using, and definitely the foot pedal control is a very important. So sometimes the foot pedal get released and you lose the occlusion and ultimately get into the bowel. Stop and chop, probably once you got into this type of problem, start and stop and chop again, and with the very low parameter, and try to divide the nucleus and reduce parameter. As I said, whenever there is a problem, you just reduce the parameter. You can trench or scalp, make it remove all the harder part and make it the epinucleus bundle. But today's scenarios, who are using the different technique. Previously we were told about the start stopping during the occlusion. If you do the occlusion, listen to the sound, occluded sound, and do the chopping. But nowadays, who are using the higher end machine, they have learned how to do the chopping in the partial occlusion mode. You really never heard in occlusion sound in case of Centurion using balance tip. So people who using this machine is gradually learning the partial chopping in the partial occlusion mode, and they really never have this type of problem once they learn this, how to learn in the partial chopping in the partial. This is a different ball game. So this kind of happen. This is a nucleus bowl. All are soft material. And if this is happen, you could get into stuck in the problem. You just hydrodissection or viscodissection, collapse the one pole and emulsify the problem. The problem is this. Sometimes there is a judgment wrong. There's a whole hard sheet in the basement. It's very difficult to understand, but it will not collapse. So if it is not collapse, it will not come to your probe. So it is very difficult to identify when your hydrodissection is hydrodissection is not working, viscodissection working. That means there is a base of the bowel, there is a thick sheet, which is then you have to go trenching or sculpting. You have to remove this. I'll show the video, and this is a different technique. And I think there is a mischop in a very hard cataract. The whole bowel is a very hard, thick nucleus, and make it to the bowel. And he will talk about this in the next session. So I am just showing this video. So you can see this. I'm going to start, and sorry, this parameter overlay system is not working that day, but I have choose this case. See, there is a gross mismatch of the every time I'm trying to hold this nucleus, but I miss. Now there is a sheet of the cutter. What I'm doing, I am scratching with the second hand instrument in the floor so that I can remove this. You see this, I am scratching. When you able to scratch, you can remove even your Phaco probe, put viscoelastic, and you can scratch over the chopper to remove the harder part of the nucleus. Once it is able to remove the harder part of the nucleus, then you will able to this nucleus will going to collapse. Say this now it is a collapsing. Before that, now it is collapsing. Even then, if you are a beginner one, you put viscoelastic, do the hydrodissection. But remember, if there is a sheet of the hard sheet in the base of the nucleus, it will not get collapse, because the whole nucleus bowel have to collapse, otherwise it will not collapse. So this is a technique I am using. The scratches the base of the with the Phaco probe, so that you can able to remove the harder part. This is another case. I think you can see this is a grade 2 cataract, but grade 3 cataract. I tried to do the misjudgment. Again, I thought it is a hard cataract. I am doing the trenching to facilitate my chopping. But once I make it, then there is a problem, and I think I will not. You see this, I tried to do the hydrodissection, viscoelastic, put the viscoelastic under the capsular margin, but it will not come, because there is a hard sheet in the base, which we have to remove now, but it is become a bowel, and it is very difficult to hold, because now it will start stenching once again. Remove as much hard material as possible. Now, just as I said, you can convert it in the stop and chop or trenching, so that now put viscoelastic. Again, now it is slightly collapsed, and you can release the nucleus. So you have to remove the soft, harder base. So this is the common situation we can often encounter. So thank you, Srini. I'm just 6 minutes. I want to highlight this talk so that if you have to remove the base of the hard cataract, so hard sheet, so that you can able to complete